Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello everyone, happy Friday and welcome to Back into Alignment. My name is Joa Rivas and I am the host of this channel that delivers information every Friday, especially for those that are experiencing back pain, neck pain, and issues with the spine. I actually was diagnosed with scoliosis when I was 15 years old, and I spent 10 years of my life with chronic back pain, and this is not a way of living. I was so curious to understand what was happening to my body that I actually became a yoga and Pilates teacher. And the last 12 years of my life has been a great journey with no pain. And interestingly enough, I somehow generated issues with my spine by having degeneration of the spine. And yes, I have now something called osteoarthritis, which you probably have here. And I'm slowly getting better. I have some herniated discs as well, and I am back into alignment. I'm here to show you that the journey of being healthy, it takes time and it takes a lot of patience and understanding that our body is constantly changing. Everything in life is temporary, and we just have to come back to the basics. Excited that now we are on February and we are launching the 30-day hip healing, which is actually a 30 days where I invite you to practice stretches from the office or from home to be able to implement habits to release lower back pain and to release tension around your quads and hamstrings. I've been practicing these stretches for the last 20 years and definitely has helped me a lot to reduce the stress that comes from my spine, especially the sacrum, which I have a slip disc in the bottom right on the base of my spine. So I am one of the students of this program and I'm actually the instructor of the program. So I invite you to be part of the program by going into my website, joafitness.com. It's only a 30-day practice. And you can take a look about the benefits of stretching and also learning how to breathe properly. Very important. Breath work is one of the most important tools that we have in life and actually will help you to expand the capacity of your lungs, but it will also help you to manage gut health. It's actually correlated. We also have a 16-week program for posture for those people that do have spinal issues like scoliosis, lordosis, stenosis. We have this program that is to improve the posture in 16 weeks, learning yoga, Pilates, and also the importance of breathing with awareness all day. We practice meditation, we practice animal movements, stretches. We also learn the food that can actually create inflammation in our joints and much more. So I actually welcome you to check the website joafitness.com where we do have these programs ready for you to practice in 16 weeks. We get great results and I'm excited for you to test it. And we are today, as always, in the Toronto Clubhouse, which is a place where we offer wellness and mental health in one space. We are so excited to open this space for our community to gather and to connect. We have always events happening. Next month on March, we have 2 events here in Toronto. For those people that are in Toronto, we have woman event for the March 8th event, which is woman empowerment, where we connect to leaders and to those that are making changes in their community, especially if they identify as women. So we are having champagne and heels where you can come and mingle with the community and learn about what's happening to co-create together. We also have the full moon meditation that is happening every month, and it's March 6th at 7 p.m. We are welcoming the warm full moon with sound healing, which is a great way to relax and to learn how to meditate with yoga nidra, which is yoga asleep, and is guided by myself. So I will be more than happy to see you and to connect with one breath. It's a beautiful practice. I welcome everybody to bring a light, a candle, and to bring fruits and sweets to offer, and flowers to offer, It's a beautiful way to give back a little bit to so much that we receive by simply being alive and having gratitude. So yes, before any further ado, today in Clubhouse and on Back into Alignment, we have a new guest. Is Dr. Nathan Relly. He is actually a very unique doctor that has specialized in two main disciplines. He's an obstetrician and a gynecologist, and he supports the woman health. Very interesting, beautiful story. And he's also a father of two kids. So I love how he has blended his knowledge from the Western and the Eastern medicine, and he has been able to create a holistic approach to his patients. He is also host of a podcast as well, and he's definitely bringing a new way, breaking and disrupting the typical way of looking at the pregnancies, childbirth, and postpartum, and much more. I'm actually so excited for you to get to hear from him and what he's doing in Kentucky. So thank you so much, my friends. Let's get very comfortable for a 30-minute conversation with Dr. Nathan. Hello, my friends. Happy Friday. Today, we are excited for another podcast. And every week, we bring you a new guest that bring light into our challenges or any type of concerns that you have, especially if you are experiencing back pain, neck pain, perhaps you have a hip issue. This is the podcast for you and maybe your family. And we are excited to have 40 years, over 100 episodes sharing, where you can actually dive into many specific topics. And I'm excited today to have a new guest. And he is actually someone that has also a podcast. His name is Nathan Riley. And I'm excited to meet him and firstly to know his story and how he started. But firstly, just to say hi to Nathan. Nathan, how are you today?
I'm so great. Thank you so much. How are you doing?
Yes, it's Friday, so it's usually we are winding down the week for a weekend. Sometimes weekends could be very busy for some careers, and for some other people, a weekend means a resting time. In my case, I get really busy on the weekend, so I'm actually excited for the Saturday and Sunday. And also in Toronto, as we are now here, it's getting really cold, so I'm actually getting ready to use a couple of layers as I walk outside. It's definitely getting really cold all of a sudden. And you, Nathan, tell us, where are you connecting from?
I live in Kentucky, south of the border. I grew up in Pittsburgh, which is actually fairly close to Toronto. Just over, south of Buffalo, you head straight towards Pittsburgh. But my wife and I, we were in California for years for all of my medical training, my residency training, and then we ended up parked here in Kentucky. It's been quite a journey.
Okay, yes, yeah, not too far. We're still really close together. Now, tell us a little bit about you. You are a physician and you specialize in women's health. Can you please tell us a little bit about your journey, when this desire of learning about women's health started, and how is the process of understanding the woman's body, which I think that's your specialty?
Yeah, well, it's my specialty as far as a man can understand a woman's body, but that was part of the intrigue for me. In medical school, everybody does a rotation where you're on a maternity unit and you're working with a gynecologist doing GYN surgery, and the mystique around birth was really compelling to me. But I also realized that as our health is declining, similarly to what we saw during COVID, women who were overweight, they were diabetic, they had hypertension, those types of things, or movement disorders, really, they were having a greater challenges in pregnancy and the postpartum period. So I figured, oh, wow, with all of my years of athletics and physical movement and physical culture and nourishing my body well, what if I could bring that into my medical practice? So I have a history of Ironman distance triathlon competition, and just played sports my whole life. I was a CrossFit coach for like 6 years, and I wanted to bring all of this body of knowledge, which is not something any doctors learn in school. I wanted to bring it into my practice in order to help people get their health in order way before they even got pregnant, and really all the way through menopause into their older age. So unfortunately, what I found was I found myself in a state of disillusionment because I didn't have the time due to our highly efficient and highly expensive medical system here. I didn't have any time to work people through adequate stretching patterns, postural alignment, breathing patterns. I mean, you name it, building muscle, cleaning up diet, sleep, getting their adrenals back in order. I didn't have time to do that, but that was really what I was passionate about. So eventually I decided I'll step out of the system and do my own thing. And now I work with women and their partners, one-on-one from, adolescence. They've got abnormal periods. They came off birth control. Their guts all messed up. Maybe they've never ran a mile in their life. They're lacking muscle mass. So they've got some degree of insulin resistance even in their 20s. And that, of course, leads to all sorts of issues throughout your life, but specifically in pregnancy. So I counsel people one-on-one. I do all of this remotely, and my C-section rate's less than 5%. Some of my clients give birth within like 20 minutes. I mean, they're really dialed in, and as far as their resources allow from a healthy lifestyle standpoint. And that's really what I was called to do when I went into medicine. So that's what I do now.
And you're a father, are you?
Yeah, we have 2 little girls. One is just turned 3 yesterday, actually, and then the other's one pushing 1.5. The second was born at home as well. My wife had a very beautiful, undisturbed, unmedicated, I would even say an ecstatic birth. She really said it was very healing, and she enjoyed it much more so than she did her first birth.
Yeah, it sounds like a fascinating journey. And going back, way back before you actually developed this curiosity about woman's body and how to be at service as a doula, pretty much be serving woman specifically. Do you have this calling from your family? That is there anyone in your family that is also a doctor? Is there anybody in your family that is a midwife or some type of relation to this? Or how do you think you develop this interest about women's health?
Well, I mean, we're all very curious. And for me, it was like, what is one area in medicine where I'll never ever have the answers? And that was childbirth. Bear in mind that OB-GYNs, 70% of what they do is surgery. It's gynecology. It has nothing to do with birth. So you're really trained very much as a surgeon, as an OB-GYN. It's very little that you spend in natural physiologic birth. So when I started attending births as a medical student, I was like, gosh, I'll never have the answers to this. This is perfect for somebody who's super curious. My mother was a nurse, and then she got into like healthcare administration. She was, managing clinics and whatnot. She had some time in the NICUs and ICUs and all of that. But my dad was an air conditioning and heating repair guy, former military vet, and I didn't have a lot of people in my life that were doing this, but I, from the age of like 18, was looking at food labels. I remember going to school and impressing upon my mom, I need to have I need to get low fat cheese. And of course that's completely changed. I'm definitely full fat in my diet, but there aren't too many 15, 16-year-olds. They're reading labels and asking their mom to buy superfoods. And so I got started off in that really, really early. And I thought that medicine would be like an added, a great addition to all of that self-study and experimentation I had done throughout my life. But in medicine, it was reduced down to just like a body with organs inside, and use medicine and, pharmaceuticals and surgery to fix things. I was very, very much more interested in getting people to reharmonize with their surroundings through healthy lifestyle. And so it turns out that I'm doing more of what I was so inclined to do when I was a young kid for whatever reason. I don't know what inspired me to do that. I was just kind of hooked on it. I was reading like Rob Wolf's books and whatnot way before medicine. And now I have all the Western medical knowledge, and I apply that, with a discerning lens to the care for people that are really here for optimizing their health and their well-being.
Mm-hmm. So you actually started from the curiosity of reading labels of nutrition and the holistic part, and then you decided to go to the medical school, which is a very serious decision. studying obstetrics and gynecology, and then combining the holistic approach that you always had this curiosity. Is it like that was the blend?
Yeah, and I wanted to feel better. I wanted to, I was kind of a scrawny kid when I was younger. I wanted to build muscle. I wanted to have abs. I wanted to build a big back muscles, and so that's where the weightlifting and everything. And I wanted to do an Ironman because I didn't know anybody that had done that. And so I started riding my bike and swimming and running everywhere I could, lifting weights, playing sports. And when I stopped doing Ironman stuff and really a lot of the CrossFit stuff, I started rock climbing because we were out in California, and just experiencing the world through the full range of possibilities of what my body could do. That was really the sort of drive that I had. And then, of course, when my wife and I got pregnant with our first, my wife we met when we were 15. So she was already pretty, interested in running and exercising, and we have always eaten a really healthy diet. So naturally, when you're a doctor in a hospital where they don't have healthy food, they don't have healthy water, you're under bright lights, you're in an operating room hunched over all day, your body breaks down. I didn't want that lifestyle for me because I had already spent so many years trying to dial in how can I feel and feel my best, have the best sex drive, have abs, have the back muscles, and try to do it all. It did leave me into adrenal fatigue in residency because I was sleeping so little, but that wasn't just another part of the journey. So I take all these experiences now, and that's what I get to do every day for people. It's actually a lot of fun.
Yes, yes. Well, you are very aware of what's going on around you. Actually, as you are chatting, and I got usually facts and statistics, over half of OB-GYN physicians experience burnout. And it's one of the top medical fields with high burnout rates, especially the OB-GYN. So yeah, basically what you're saying, like how could you be supporting the community studying by yourself? So it's a good practice now that you found a way to be able to be everywhere, anywhere with the online approach that you are providing to everybody. And today, because I'm sure your journey is so interesting, we will be chatting more about your journey specifically. Today, for those listeners, they are with me for 4 years. Most of these listeners have some type of a spinal health issues. For those people that are listening for the first time, I actually had scoliosis diagnosed when I was 15, for 10 years, chronic back pain, 12 years of no pain, competed on fitness shows, no Ironman, but yes, fitness shows that allow me to build enough strength, muscle. And then after many years, I'm here sharing my story. I actually was diagnosed with osteoarthritis, so definitely have some type of degeneration of the bone. But I truly believe that our health is in a constant transition, and it's up to us to know when pain comes is a way to teach us something. So if we can come back into alignment topics, could you please share with us for a short 10 minutes conversation with me, what are the most difficult issues that a woman experience related to the spine and the pregnancy? Because I know this is something that you are very close to, specifically with pregnant women. I had before pelvic physiotherapists based on only the pelvic floor, and we had very deep talks about this topic. But I would love to hear from you, like how do you see that is the misconception between the core muscles and the pregnancy in this time of the of life? How do you see that?
Well, it's a good question. So the first thing that comes to mind is that if throughout your entire life you have developed a habituated way of standing or moving, whether you're lifting weights, lifting your groceries, whatever, whereby your spine is not in proper alignment, you're going to eventually develop some inadequacies in the nervous inputs and outputs from your spine to your vital organs, including your reproductive organs, which are not vital. But if you're struggling with fertility, struggling in pregnancy, and you don't have adequate blood flow, which is a reflection of nervous input to those tissues, you can develop all sorts of complications. That's the first thing. So for my fertility clients that come to me, I have a very comprehensive natural fertility program called Patience, Reverence, and Presence, the PRP program. A big part of that is getting you moving better. And it's not weight loss. It's a matter of getting your spine from your atlas all the way down to your sacrum in the proper alignment, so that anytime you're moving in any direction, whether it's rotational, it's translated, it's jumping, whatever it is, there are certain simple principles that you've probably not been thoughtful about. And the idea is for that to become a new habituated way of standing, walking, running, getting up, sitting down. That's the first thing. The second thing is that women have been conditioned to think that they're supposed to have a flat belly for their whole life. And so sit-ups, Pilates, all this other stuff, what happens if you're not thoughtful about not just your postural alignment, but your breathing, is you develop a sort of a paradoxical breathing pattern. When you breathe in, your belly should expand. But because women have been told you need to have a flat belly, men are not going to like looking at you naked if you have some belly fat or you can't see your abs or whatever else. So what they do is they keep their abdominal wall hard. Your spine is now firm, your abs are firm, and when you contract your diaphragm, it compresses this chamber, your abdominal cavity, and the only place for that pressure to go is into the pelvic floor. So many women develop dysfunction within their pelvis, whether it ends up being really bad, like prolapse, or even just, hey, I now leak urine when I cough or sneeze, something called stress urinary incontinence. Or you accidentally pass gas or lose stool once in a while because the muscles that help keep your pelvic floor functioning properly are either overstretched, they're in spasm on one side or the other. The dysfunctional breathing patterns will not only lead to this this compression and let's say dramatized tension in the pelvic floor. Deep breathing, expanding your lungs fully, also helps to move cerebrospinal fluid, which is the fluid that surrounds your spinal cord all the way up through your brain. So when you're not breathing deeply and you're not aware of how your pelvis and your sacrum alone, not to mention your lumbar spine, your thoracic spine, all the way up through your cervical spine, when you're not aware of how these things are working, you're going to end up doing harm to yourself. And this manifests in a number of ways in pregnancy. Specifically, when you're having a baby, if your pelvic floor is super, super tight, and they've got abs, they've got shoulders, they look great in yoga pants and all of this, but their pelvises are so locked up that the baby just can't navigate through. The pelvis is not expanding appropriately. And if your movement patterns are in order, if you have adequate muscle mass, you're going to decrease the risk of gestational diabetes, risk of tearing the tissue down there, the risk of needing a C-section. Those types of things actually become very real things. So exercise in pregnancy is the one lifestyle measure that has been demonstrated through many, many, many studies to reduce your risk of virtually every pregnancy complication, including C-section, including postpartum depression, all of that. So moving well, getting your spine in alignment, and developing healthy breathing patterns is critical.
Exactly. Well, you definitely share so much in a holistic way. I truly know so much that you share, especially that the posture is so important. And this actually podcast is a reminder for women that have not been pregnant yet to start working on the alignment of your body and the strength of your core muscles and the breath work, of course, that you were commenting. Now, not when you're pregnant. I truly think that the creation starts by our own health first before we actually conceive. And it's something good if you actually still in your mind thinking about one day being a mother, then it's definitely a call for you to remember that the posture and the breath work starts even before you are pregnant. Because then later on, if you're already pregnant, you may have these functions already really embedded. So it's pretty hard to reprogram it, but still there are ways to reprogram it. You mentioned a lot about breath work and how the stomach, the abdomen muscle is always contracted just for the aesthetic to look flat. We definitely encourage you. I am a yoga teacher for over 12 years, and I definitely encourage all my students, my friends, to become aware of the most powerful tool that we have as a human beings, is to actually learn how to breathe properly. There is actually studies that says that nowadays, with the anxiety and the stress levels, people are doing very shallow breathing, and the shallow breathing is more than about 10 to 12 breaths per minute, which is a very quick breath. So ideally, we encourage you to breathe slower. So means bringing more air into your body, and then breathing out for longer. So ideally, you want to breathe between 5 to 6 breaths per minute. If you could for sure, but yeah, it takes time to reprogram this, which is going to rebalance so many systems in our body, including our gut health, which we have so many episodes talking about gut health and spinal health, which is correlated. As you were commenting about pregnancy and the posture, you also commented about certain issues that come from the lack of awareness of the muscles and the breath work. You commented about incontinence, and you also commented about the high rates of C-section. Question: I hear a lot about women scheduling C-sections like it's just a procedure, like nothing. They don't even make the effort to try to do a delivery, like a childbirth delivery, natural. I wanted to ask you your opinion about this, and if it's something that is just a fear, or it's just because it's cheaper on the clinical part. Like, can you please give us a little bit of, you as a doctor, like, what do you think is the main reason that women choose to be taking the C-section as the way to deliver the baby?
I think that our culture, mother culture, has mm, clarified for us notion that having a baby by vagina is very scary. It's very hard, very painful. All these bad things can happen to you, and because we don't like to talk about birth, it's too icky. It's birth and death are the two things we don't like talking about around the dinner table. A young woman has been avoiding pregnancy her whole life, out of fear of an unintended pregnancy. And on birth control, which messes up your gut. I mean, it changes your mood, it messes your nervous system up, your immune system, endocrine system, right? And then bam, you're 25, 26, you come off of birth control, and now you're trying to get pregnant. But that fear that we instill in women at an early age is still there. It doesn't change. And then, of course, in the media, we only ever see crazy bad things happening in childbirth. We don't ever really get to see, what does a really natural, undisturbed birth look like? When I was in my training, one of the things I started doing was going to home births with midwives, working with doctors that really had an appreciation for this as not a medical procedure, but a natural physiologic process. And when you can start to reimagine birth, not as this inevitable disaster on the brink, but an opportunity to get to know your body better, to dial in your health, to really start caring for the health of you, your baby, your family, cleaning up your environment, your lifestyle, to whatever degree your resources allow, it becomes an opportunity to really grow as a person. But instead, it is also sold by doctors as, hey, you don't need to worry about that. Let us take care of that for you. And we can get your labor going. We can do a C-section. Unfortunately, in the United States, as in Canada, most babies are being induced a little before, not most babies. Let me reframe that. Many babies, 1/3 of babies in the United States, the labor is induced, meaning we try to get labor going prematurely before the baby and mom have decided it's time. Likewise, 1/3 of babies in the United States are born by C-section, and a C-section should not be as routine as it has become. 1/3 of babies coming out through an incision in the abdomen is crazy high. So even the World Health Organization suggests we should have this below 15%. My rate since finishing my training has been less than 5% consistently. And the reason that that's important is because I try to empower and educate my clients so that they embrace this opportunity to get to know their body better, to become empowered and embodied as a woman who's going to give birth, as opposed to outsourcing that power to a doctor who's just really, really good with a scalpel.
Mm-hmm.
The problems with C-section are, if you're going to have 4 kids, your 4th C-section is a very hard surgery. There's the risk of the tissues sticking together, injury to your bowel, to your bladder, higher risk of bleeding, of infection. The recovery period after a C-section is way harder than after a vaginal birth. And these are all the things that we underemphasize those risks, not to mention bonding between mom and baby. When you're strapped crucifixion style on an operating room table, it's hard to breastfeed and connect with your baby right away. But that's really what most women want. So it's not nobody should feel shame for having a C-section, but doctors should really be thoughtful about how they've been overemphasizing the benefits and playing into that fear that this woman has developed over years of media and Instagram and everything else about childbirth, and maybe emphasizing the benefits of having a vaginal birth. I think that's really where it's at. And one thing I didn't mention about the exercise component, we were talking about that abdominal wall. So many women have adopted, like, I have to crunch, I have to sit up, I have to really strengthen my abs. Well, the problem with that is you have a growing uterus inside of there, and the muscles laying over that are going to separate more than they have to. They're supposed to stretch out. They're supposed to separate a little bit. But if you force those muscles to be super tense over this rock hard uterus for all this time, you're going to end up with a big diastasis recti. And it's even more so with a C-section, where we're pulling those muscles apart violently in order to make room to operate on your uterus. So I think that's why. I think women have just become inundated with bad messaging around how unsafe pregnancy is.
Yes, exactly. Very interesting topic. Definitely. I know we can totally go through all the misconceptions, misbelief, fears, myth, so much related to C-section. I actually, I was a C-section, but it was definitely needed because I'm a premature baby. So definitely for my mom was the only way. And it's definitely not as easy as it sounds, and definitely will affect the key muscles of your abdominals, especially your transverse abdominis could be also affected tremendously, and it can create issues to be able to wrap the midline and the spine. So it will also, like you say, it will be a longer recovery when you have a C-section. And that is something that we definitely need to bring more attention, especially as doctors, try to understand the consequence of the C-sections. But I just noticed, like, I just listened so much about, no, I chose to do C-section before they even try to do any type of approach for vaginal birth. So yes, this topic is interesting, also affects the spine, and it's something that we can definitely talk for over an hour. But our time is finishing for now. For today, we just always invite guests. We talk about specific questions that people have, or like information that it may be interesting to you. And if you found that this topic it could be beneficial for a friend or maybe for your family member, please share it with them. The whole idea of the podcast for the last 4 years is to educate, to give some guidance, and also from doctors, that is so important for us to see that there are doctors that look life in a holistic way. It's not always the traditional way. So I always try to bring the holistic way, knowing that we are a unit and we cannot separate any aspect. We're all an emotional being, mental, physical being, and also working in a community. It's so important to know that you're not living life alone. Very exciting, Nathan. I would love people to know about your podcast and about your social media.
Well, thank you, Joa, for having me. My podcast is called the Holistic OB-GYN Podcast, very appropriately named. And my practice is belovedholistics.com. We're going to be having a very big course rolling out in the next couple months called the Born Free Method. Reach out to me if you're interested, but it's going to start everywhere, everything from taking responsibility for your decisions and the outcomes of those decisions, all the way through lifestyle change and modification, through the actual ins and outs of what pregnancy looks like postpartum. There's a unit there for dads. It's a very comprehensive kind of everything that I do in my in my counseling for clients. But people can reach out to work with me. I do have a fertility program, and I do one-on-one counseling for women and their partners. Search around at belovedholistics.com. If you have any questions, you can always book a free discovery call. I have health coaches, I have Chinese medicine docs, I have chiropractors, I have exercise specialists, all sorts of people who work with me. Just reach out. I'm a pretty open book, and thank you for having me, Joe. It's really been a pleasure.
Well, yes, I think we're going to have you again, hopefully next week. I think there is so much that I will ask you after this conversation. You just gave me so many ideas, especially for fertility. I have noticed that fertility is affecting a lot of women in Canada. At least I noticed like women from 30 to 35 are struggling to conceive. Why? Because back in the day, women by 20, they were pregnant, but now by 30 is when we're actually thinking about that, and then there are some difficulties. So I would love to talk about that, because I know a lot of women that are in my community would love to hear this type of information that will be very important for them in this moment. And there are so many other topics that we're talking about: the spinal health and the pelvic floor, and the pregnancy and conceiving and postpartum. There's so much use that we can get from these fruits. So yeah, thank you so much, Nathan. I'm very, very excited to have you again. I think what you're doing is unique. Definitely somehow you are being guided by higher self for to bring this knowledge. I'm sure the podcast will be part of your legacy. Excited to be listening to more of this in your podcast. If you guys want to follow Nathan also in Instagram, he's constantly posting about these topics in Instagram. His Instagram is Nathan Really OB-GYN. So I will add all this in the chat box, and I can't wait for you to come back next week and share with us another conversation. So thank you so much, Nathan. And everyone, remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.